this is Dr. Camille, and today we are going to review your micronutrient testing. So I love micronutrient testing because it really gives you a clear idea of what vitamins and minerals and supplements that you might be deficient in and which ones you would benefit from. You know, sometimes we get into this, I read an article about, magnesium or something, and I go, you're tempted to buy everything. And at some point you go, what do I actually really need? The other thing is that you may have done testing in the past and maybe you just don't know how to interpret it. And so what we're going to do is we're going to go over how I would interpret your test, okay? So you get personalized testing to say, how do I interpret this? Not just what are the highs and lows, but it's much more nuanced than that. So let's get into this, and I'm going to explain to you exactly how I would interpret this test, and I'm going to give you some examples along the way, okay? So grab your micronutrient test if you have your results handy, and let's go over it, okay? So the first section, and what I love about this test is how they break it down by categories, okay? So the first one is vitamins, okay? Now, I've highlighted some for you that I would read as low, okay? Now you'll notice your key there is green boxes are good, they're within the reference range, and red boxes are low. But the nuanced thing in how a functional medicine doctor would interpret this is that we want optimal levels, not just levels within range, okay? So what I've done is I've highlighted some for you. So if you look at the first vitamin where it says vitamin A, and you see it's in a green box, and you see that your value is 75, and then you look at the reference range on the right. Now you'll notice that the range is from 40 to 90. So even though 40 technically might be within range, it's certainly not optimal. And so when you look at each of these values, I want you to think about being in the top third of the range, okay? And that's where you're going to find your optimal levels, okay? So for instance, if I look at 75 and I see on the right my reference range is 40 to 90, then I realize that I'm pretty well within the upper third of that range, and that's okay. Now, by comparison, look at B1 below that, okay? Now, this is in a green box, okay? The value is 70. But if I look at my reference range, it's 71 to 180. So clearly, this is not an optimal level. In fact, if you drop by 1 point, you would be red, okay? So that's the nuanced way that you need to look at these. Don't just look at green boxes as good. You need to say, is it within the optimal range? So when I look at B1 and I look to the range of 7180, I really want to be somewhere, above 100 at least, maybe above 150. And so I highlighted that as that's actually a low, something that this person is going to want to replace, okay? Now, and so what I would do is I would go through each one of these, okay? Now, if you look at B2, you see that the value is 256. If I look to the right, the upper range is 290, so that looks okay. But if I look below that at B3, I see that this person's at 31, and to the right, the reference range is 5 to 80. Well, 30 is not even to the mid-range of 80, right? So you'd have to be at least 40 to be halfway there, and really you'd have to be 50 or 60 to be more close to optimal. So I highlighted that this person is not in the optimal range. And these are real patients of mine, by the way, okay? Now, you look below that, B6 is 49. It's roughly halfway between the reference range of 4 to 83. And so what I would say, and why I like that they group this, is that you'll notice they put all the B's together, okay? And so if someone has a few or multiple B's that aren't, optimal, which this person does, because I would argue really almost none of them are optimal, some are lower than others, then this person would really benefit from a full B complex. And really, to be perfectly honest with you, everyone needs B complex. And that's because B vitamins are used in many, many, many chemical processes in our body. They're used for detoxification and methylation and lots of things. And so they get depleted. And so really most people are deficient in B vitamins. So, everyone hears about B12, but it's really so much more than that. We really need all the different ranges of B vitamins. And so you'll see in this key I put here in the white box with words, would just be my recommendations on this page that this person's kind of low or deficient in a lot of the B vitamins, so I would do an activated B complex here. Okay, now if we keep going, you see the red box there is vitamin C. Now, this is low, and you're going to see this low in a lot of people because vitamin C is a water soluble vitamin. And so it kind of just runs right through. Your body takes what it needs and then it runs through. And so most people really should be taking vitamin C on a regular basis or eating high vitamin C foods, okay? But this person is deficient. That's why it's in the red box. You see that their value is 0.2 and the reference range is 0.5 to 4. So definitely they need some vitamin C there. Now, below this, there's vitamin D3. Their value is 2.6. The reference range is 1.1 to 5.2. Now, you could argue they're roughly at the halfway point, so they're not really deficient. I went ahead and highlighted this one because I want all of you taking vitamin D. I like to tell people there's really 3 things that I think everyone should be taking. One of which is vitamin D because we just don't get the sun exposure that we once did. Most people are low. This is so valuable for, there's just tons of published research data showing that vitamin D protects against various cancers, including colon cancer, breast cancer. It protects against dementia. Obviously, it's important for our immune system. And so really, you want to be top range always in vitamin D. So I went ahead and highlighted this so that you can just see how important it is. And this person's like midway, but certainly could be higher. If I look at vitamin E, 24.9, and the upper limit's 30, so that's pretty good. And then the other ones I kind of said, hey, those are pretty close. The vitamin K2, you see there, they're at 4.14, and the reference range says 1 to 8. So they're about halfway. And realistically, I like people when they're taking vitamin D, I prefer that they take vitamin D3 plus K2. That's because it helps with absorption of the vitamin D. And a lot of people are also deficient in K2 because guess what? It's made by your gut microbiome. And most people do not have healthy guts or microbiomes, and therefore we really benefit from taking K2 also. So you'll see that in the key here on this person, I would recommend that they start an active B complex, they take vitamin C, and they add a vitamin D3 K2 supplement. Okay, let's move on to the next section. And now we have our mineral category. Okay, so let's look at calcium. 16.7 is their range, and you look at the rest. So again, this is a green box, but look at the reference range, 15 to 30. So, they're about 1.5 points away from being a red box. So that's what we want to avoid. So that's why I'm doing this webinar, because I want you to really understand it's not just about green boxes, it's about optimal ranges. And so this person, I would say, is not optimal in calcium. You see that below that manganese. So that's actually a mineral. It's not magnesium, it's manganese. And you can see they're at 9.7, but the reference range is 8 to 19. So again, this is not an optimal range. And you can kind of go down. Actually, I forgot to highlight zinc. Look at zinc, 4.4. They're barely within the reference range. Below that, copper is 1.3. And down the line. So what I like about this, if you look at all of those are minerals, and another thing I often put people on is a trace mineral supplement, and it would have all of those supplements in it. And so again, if you're deficient, like this person's deficient in 3 of the 5 of them, then I would just go ahead and start a trace mineral supplement rather than trying to do each one individually. Then we look at iron, which is highlighted. So you see iron, this person is 91.5, and you see the reference range is 88 to 117. So again, not quite optimal there. Iron is interesting. Now this person is a male patient of mine, and men tend not to be as deficient in iron as women. Most women tend to be iron deficient, but iron is really important for thyroid function and energy, as well as, red blood cell volume, etc. So you do want to get these iron levels up. And a lot of people are used to, over-the-counter, ferrous sulfate supplements. Those are pretty tough to take. They lead to a lot of constipation and sometimes GI upset. So you'll see below, I'm recommending in that box a type of iron called ferrous glycinate that tends to be much more absorbable, much less constipation and GI upset. Okay, below iron, you see magnesium, and that's at 7.4. That actually looks optimal in this person. I think this patient was already taking magnesium because, like B vitamins and vitamin D, I think everyone needs to be on magnesium. Magnesium is a cofactor in over 400 biochemical processes in our body, and so it definitely gets used up. Also, you see that the calcium's low. And the vitamin D was not quite optimal. You know, a misconception with people is that to protect my bones, I need calcium. Well, to protect your bones, you need minerals, you need magnesium, and you need calcium, and you need them all to be balanced. So, very important to balance all of them. Okay? All right, let's move on to the next slide. Okay, so again, another category. They put this as metabolites. Interesting, choline and inositol are really fairly unknown by most people. A lot of people consider these almost like B vitamins. They have some B vitamin sort of properties, I guess you could say. I got to tell you, recently I started taking choline and inositol, and it's been pretty life-changing for me, honestly. Inositol is really important for the nervous system. It's really important for cell membranes, and it's really important for sleep. And I've been taking it at night, and I have just been sleeping so soundly, sleeping like a rock, which I had not been doing for a long time. It's also really, really, really important if you have PCOS or know someone who does. There's lots of studies demonstrating how important inositol is for treating PCOS, which really is a sort of insulin and metabolic syndrome. And so inositol works really great for that. So you can see here, their choline and inositol are both low. They're in the red box. Choline, by the way, is also super important. This makes acetylcholine, which is really what is really the main target they look at for dementia. So as that starts to drop, people can't think as clearly. It's really choline makes up the lining of nerve cells. So really, really important for the nervous system. Below that, you see carnitine. Carnitine's in a green box. So again, we don't want to just, okay, it's green. I want to look at the value. So here it's 71. And I look at the reference range, that's 20 to 75. So I would say, yeah, that's pretty good. It's in the upper third there. Carnitine is really important for blood sugar management and helping with weight loss and muscle maintenance. And so I would say that one looks pretty good. Now, MMA is a little bit confusing, but what MMA is it is a sort of a byproduct of B12. And so it's a reciprocal value. So, if MMA is high, that could signal a low B12. So kind of weird, just tuck that away. This value looks fine, but if it was above 14.9, I might think that this person needs some B12. Okay? All right, let's go on to the next page. All right, so here we have our amino acids. And what I really like about this test is that it actually checks the essential amino acids. You know, it's funny, I used to years ago use a micronutrient test I really liked, but a patient kind of said, well, it's weird, it's checking amino acids, but not the essential amino acids. And I thought, you know, that is weird. So amino acids are kind of broken down proteins or protein precursors. And there's some that we can make within our body and some we can't. And so these essential amino acids means that we cannot make them and we must consume them. Now, most of these, if you eat a high protein diet, you're usually going to be okay on amino acids. But certainly if you're eating a low protein diet or maybe you're a vegetarian, this is going to be really important to you. So this person, you know, eats a fair amount of meat, and you can see, you know, mostly I'm looking at asparagine, their value is 132, and you can see the reference range is 90 to 160. So, you know, that looks pretty good. And I kind of go down the line, the glutamine's kind of towards the top, you know, the serines borderline low there. You look at the values 192, and the reference range is 184 to 280. So that one is, you know, on the low end. And when I went down the others, they looked pretty good. Now, what I would say is if, let's say, especially if you're on a low protein diet and all these are low, and I have seen that, your best bet, and that's why I put this below in the white box, is, to take an amino acid supplement or collagen peptides, which are really popular right now. That provides a lot of, amino acids, because that's what collagen is. It's amino acids and protein precursors. So, I really love the Vital Proteins amino acids, the collagen peptides, and I also really love Body for Health. They make some great amino acids. So if you're low in all of them, I would say get a good, peptide supplement. If you're low in, see this person here, they really only low on the one. And serine is interesting. Serine is really, really important for cortisol balance. And people who have really high cortisol, really high stress, they tend to have trouble sleeping at night. And so I use a supplement that is listed here in that white box called phosphatidylserine, or sometimes we call it like PS 150. And so this person was started on some PS 150 at nighttime. It works as a natural sleep aid because it helps to lower that cortisol, and it works really nice. So in this case, this person, can just take serine. Now we'll see the antioxidants below, which, of course, antioxidants is what kind of helps protect us from all of the cellular toxins and stuff that we're exposed to. So the CoQ10, you see coenzyme Q10, the first one there, 2.08, that's, about half mid-range, 1.1 to 4.89. So this person could use some CoQ10. Sometimes if they have a lot of abnormalities and some are lower than others, you might want to start the more obvious ones so you're not bombarding yourself. But in this case, if you look at the ones below that, cysteine and glutathione. Well, cysteine, if you look, is pretty low. The value is 14.4 and the reference range is 10 to 37. So that's low. Well, cysteine is actually, a lot of people have heard of NAC or N-acetylcysteine. So that's what NAC is. It's cysteine, and cysteine is the precursor to glutathione. Okay, so you see below this, his glutathione is low, right? So his glutathione is 195 and the reference range is 176 to 323. So it's not surprising. His cysteine's low, which he needs to make glutathione, and his glutathione's low. Okay, now glutathione is our master detoxifier. It's the main thing that our liver makes to detoxify us. So you don't want to go around with low glutathione levels. So those two were highlighted, and you can see below that. So on this page, I would recommend this person start phosphatidylserine at night, and then I would recommend starting some NAC. And, in this case, you could maybe just start the NAC, the N-acetylcysteine, and see if that's enough to bump the glutathione, or you can add a glutathione supplement as well. Okay, so let's go on to the next category. Okay, now this is an add-on. You're only going to have the whole blood omegas if you do the add-on test. Now, this is an important marker because, a lot of people know that we need omegas, we need, fish oil. Some people don't realize how important it is or why it might be off balance. Some of you are savvy enough, you watch your health and you know about seed oils, we call them. Most of our processed food today is made with various seed oils. That's like palm oil, corn oil, canola oil. Any of those types of oils are heavily processed under high heats and pressures, and therefore their molecular structure is changed, and it's very, very inflammatory to our bodies. So a lot of those seed oils actually fall under omega-6s. So some omega-6s can be good, like avocados have omega-6. But the problem comes when we're ingesting so much omega-6 because of all these seed oils in our foods. And, we're not ingesting enough of the omega-3s, the fish oils, which are much more anti-inflammatory. So the omega-6s can be inflammatory, especially if out of balance. And the omega-3s are much more anti-inflammatory. So we want to have a good kind of balance between the two. So if you look at the top ones, DHEA is the first one, and then the next one, that long word, but it's EPA. So most good fish oil supplements are going to have a lot of DHEA and EPA in them. That's what we want. And then you see fourth from the top, it gives you your total omega-3, and he's at 8.41, kind of middle of the range there. The reference range is 3.25 to 13.99. Okay, then it gives you, so the arachidonic acid, the AA, and then below that, the linoleic acid. Okay, those are your omega-6s. So the top two are your, make up your total omega-3s, and the next two, the arachidonic acid and the linoleic acid, make up your total omega-6s, okay? So those values look okay. They're within the reference range. But what we're going to do is compare them in a ratio. Okay, so first up, we're going to look at your total omega-3 index. Now, your omega index, you want high, and this person is low. So you see they're in a red box, 4.33, and the reference range is 8 to 12.6. So I kind of put some information in there for you, but if you really want your omega-3 index 8 or greater, this is a marker that people will use for cardiovascular risk. So if your omega-3 is less than 8, you have an increased risk of cardiovascular disease and cardiovascular events like strokes. Okay, so this person really needs to get their omega-3s up. Now, if you look at the next value, AA to EPA ratio, that one looks okay. But then if you look at the omega-6 to the omega-3 ratio, you see the value is 2.53. So, and I put this key down at the bottom for you so you can see that an AA to EPA ratio of 1.5 to 3 is low risk for cardiovascular events. And he's at 2.53. So he's within that low risk. But if that value is as high as 6, you're in the moderate range. If you're 7 to 15, you're elevated risk. And if you're higher than 15, you're at high risk of cardiovascular disease. And so that's how this should be used. This is really a screen because there's lots of different tests that we can do to really truly figure out your overall cardiovascular risk. Not just wait till you have a heart attack or plaque one day. And so for this person, he went ahead and just added a fish oil supplement to his diet. And he's, watching those seed oils in his diet, and that's going to help raise that omega-3 index and then, lower the ratio overall. Okay, so let's go to the next slide. Okay, now, so that's the end of one patient. So I gave you 2 different patients so we could just kind of reanalyze, just to give you some practice so you kind of understand, again, if I was looking at your results, what it would look like. Okay, so this is another patient. This is a female patient of mine. Okay, so vitamin A at the top is 68. The reference range is 40 to 90. So yeah, she's in about the upper third there. That looks okay. Now you can see B1 is clearly low because it's in a red box. You see B2 below that is 159 and the reference range is 137 to 290. So again, on the low end, right? She's in the lower third. So I highlighted that one as not optimal. Below that is B3. And her value is 19.7. We look to the right, the reference range is 5 to 80. So again, not optimal at all. So it doesn't matter if it's a green box, it's not optimal. She needs that. Okay, and so I just went down the line, okay? So again, in this case, this person needs a B complex. And again, most people are gonna need, if you're not taking B complex, odds are you're gonna need one. Okay, now you see the vitamin D3. Oh, I'm sorry, I skipped vitamin C. So vitamin C 3.2 and the reference range is 0.5 to 4. So her C looks great. D3 is 1.4 and the reference range is 1.1 to 5.2. So you can see barely even in the green. Definitely needs a D3 supplement. Her vitamin E below that is about halfway in the reference range. You see both vitamin K1 and vitamin K2 are low, and then her folate looks fine. So again, this person's going to need a D3 plus K2 supplement. You might be wondering what K1 is. K1 is actually really important for blood clotting and wound healing, also for bone health. So this person could benefit from a K supplement. There are supplements that contain both of these types of vitamin Ks, and especially for maintaining bone mass, really important to have both of those. Okay, let's go to the next slide. Okay, so now again, we're at minerals, and you look at the calcium. That looks about halfway in the range, or maybe a little higher. Manganese is just barely over the halfway. So really you could highlight this one. Zinc, again, maybe halfway. So, this person, of course, we could all benefit from trace minerals. She could probably get by without it, but, you may want to add that. Um, Chromium is at 0.5. You see the reference range is 0.1 to 1.2. So kind of less than halfway. I kind of put that in the box below just for your understanding. Chromium is really important for regulating insulin and blood sugar control, helps with weight loss. So definitely if you're on the low side of that and struggling with any of those things, definitely I would go ahead and add that in. You see her iron is a bit low at 97, again in a green box, but not optimal because the lower range is 88. Okay, and then if we go down to the metabolites below, we look at her choline at 22, and the reference range is 10 to 35, but you see inositol is 42, and the reference range is 40 to 85. So she's definitely low in inositol. And then if you look below that at carnitine, at 24.7, again, she's kind of barely within range there. So this person, I would definitely put on some inositol powder, which just, again, helps with sleep, blood sugar management. And then carnitine is, really important for muscles, building muscles, maintaining muscle mass, and other things like that. And then her MMA looks fine because it's not high. So that means her B12 looks good. Okay. Here's her amino acids. Again, this person eats a very high protein diet. So all of her amino acids look pretty good. If I look at the antioxidants, looks like her coenzyme Q10 is okay. Her cysteine and glutathione look pretty good. Now, selenium's kind of interesting. A lot of us think of it as, it goes with minerals. It's also really, really important for thyroid health. But it is actually a strong antioxidant, and a lot of people are low in it. So that's why they put that in the antioxidant category. Now, if you're not taking a trace mineral and you saw that your selenium was low, I definitely would add just a straight selenium supplement. However, if you're taking a trace mineral supplement, many of them, especially the one that I recommend, has a good amount of selenium in it. So you would not need to take selenium with that. So just be careful. You don't want to take too much. But it is super important for not only an antioxidant, but really important for thyroid health. Okay. Okay. And we have completed all of the categories. So this is just kind of a way for you to test yourself at home, find out what you need, and really be able to treat yourself, get your micronutrients optimized, which is so important in preventing lots of diseases. I like to say that there's really no such thing as a disease of old age. It's really the reason why people get diseases as they age is really kind of a value of toxic burden and not optimize things like low micronutrients, low vitamin D that would have protected them against breast cancer or colon cancer, or low minerals that would have helped prevent osteoporosis. Okay, so this is really about optimizing things to optimize our health, and you can do this at home. So all of the supplements that I talked about in this webinar, I have compiled into one location on my full script. If you're low in any of these, definitely feel free to go to this full script account and order the supplements that you need and get yourself optimized. Okay, and this is to your health, guys. In case any of you need to contact me, here's my contact info, and this is to your health. All right, this is Dr. Camille.